Good afternoon. This is Dr. Bill Wyatt again, and I'm a general dentist, of course, and I've done nothing but orthodontics since 1970. I think that's about 42 years ago, and a good many years before that I did a lot of orthodontics and as well as general and pediatric dentistry. So I want to get back into talking to you today about separators, but I am a member of the American Orthodontic Society, and you can become a member of this also. Now, just being a member doesn't make you able to do orthodontics, but if you pass the boards, or there's a whole series of steps you go through to learn that, and you can join the American Orthodontic Society, and you can take tests and study, and when you do so many hours of study and pass these tests, you can sure do orthodontics. So now we're concerned about doing good, solid orthodontics, not a bunch of mess and stuff like that. So anyway, let's get back. I want to talk to you about separators today. That's an interesting little item in orthodontics. Back when we did nothing but bands, God, it was a huge item, and it was a painful thing separating all these teeth. But now we use separators for several different things, and if you watch this and you haven't really learned how to use them, maybe we can help you a little bit along that way. Let's change slides here, and separators today come in kind of these little the plastic actually is, and it's opaque. You can see these under x-ray, and they stretch pretty good, and they come on a deal like this, and they sell you a thing to put them on with that is to me, don't even use them, because you can do so much better putting these things on by using dental floss. This is wax dental floss, 2 strands of wax dental floss, and what we do, we run one hole through here and come off and come over here with the other side, and you pull them off, and then you put another piece of dental floss in the other end. Now the dental floss is quite long out here, and we'll show you how you can really put these things in with dental floss, and you can't do it with those pliers they give you. You stick them in some places, but not many at all. But the way to put them in is with this dental floss, just believe me. I'm going to go to the next slide here, and here you drop one strand of dental floss through there, and then you pop it off of this ring. It'll break that little thin piece of plastic right in here, and it'll slip off the ring, and then you put another piece of dental floss in this side over here, and you can stretch that thing and do some marvelous ways of putting them around teeth and opening up spaces, and actually aiding the eruption of wisdom teeth and teeth that haven't erupted yet. You can aid it a great deal with this dental floss separators like this. So we'll go ahead now, and let me get the another view. Now here are the two pieces of dental floss in the separator. This is coming over here like this, and going in, coming out over here, coming in here, out on this side. Now, a lot of people don't understand waxed dental floss. The floss is not woven in any way. It's just strands of nylon, real tough nylon strands. And as you go between two teeth, you've got a tight spot that this goes through. This dental floss will spread out to where it's just one or two strands of the floss going through the gap at the time, and you'll get the whole thing in there. Sometimes we start on one side with it and press it, putting pressure on it, and it'll just feed it through, and you get the whole strand, both strands of the dental floss through there. And then you pull on one side and pull the separator up between the teeth, like you got a couple of molars here, and they may make contact here, and it may be tight as all get out right in there, but you run this floss down through here, and now you pull on it. If this is one side or the other, you can just pull on it at kind of an angle like that, and this floss will go down to this bifurcation or this separation right in between here. And now you've got your separator down in here with the floss coming out the other side, and you kind of stretch the floss, and it can pull on it, and it'll take the separator and thin it out kind of like that, with the floss coming out the two ends. And now you drag it with one side, and it'll pull it in underneath the contact point right here. Then if you stretch the separator out and put a lot of pressure on it, you get it pretty thin. Usually you can slide it up between here, and then you'll have the separator here and down here at the bottom. Let me kind of clean that up a little bit here. So you've got the two teeth setting something like that, and the separator will be right up above this and underneath here, but it's stretched out. And then the separator absorbs liquid, and you leave them in, say, several days, sometimes about a week, and they'll swell, and the teeth will come back, the patient will come back in after several days, and there'll be a little gap in between the teeth right here, so that you can band the teeth and get your bands put on there properly and get them to going. Like now, we use bands on our molar teeth with attachments on both sides and everything. You can't really use bonded things. The 6-year molars are loaded with attachments and everything in there, so we need to separate that area. Now, that's not the only thing that we can do with them either. I'm going to show you some other things where we aid in the eruption of, say, second molars or even wisdom teeth. I've brought a lot of partially impacted wisdom teeth in with nothing but separators to do that. So let's go on to another picture here. Now, this is a picture of our intruding wire that's coming out of here, and it's got this deal, and it's activated, and here's our regular arch wire in here. I think this picture just stuck in here, but that's a pretty good view of the intruding wire and this omega that comes in on our conventional arch wire, and we're able to tighten this thing up. But let me skip that picture. You don't need to forget it, but that's a pretty good picture of that. Now let's see. Okay, that's popping the thing off. We got it. We separate it. Now we pop this in here, and now we're going to pull that in between the two teeth. Just kind of stretch this, and this will get longer and thinner, and you slide it in underneath here, and then you work the ends of the floss up like this, and you pull on it, watching part of the separator over here and part of it over here, and just as the one side of it slips past the contact, then stop real quick right there. Don't pull it too hard. You'll pull the whole thing through and have to go over this procedure again, and then you'll have the separator stuck right in that area, and they separate. I mean, there's no question about it. After several days in there, they really separate the teeth. Now there are different ways too. Let me explain that. I don't know whether I show that. Like if you cannot get this separator to pop up in here, you can have the separator end of it over here and the floss coming up here, up in this side. You can take these double strands of this floss and pull them together and tie a knot in them, and pull the separator out here and here with a knot in the floss here, and make about 3 knots right in here, and that will have a double separator in this area, and it really puts some force on there to separate it. So you can tie them with these 2 pieces of dental floss right here. You can tie that so it's kind of got a double deal. Say your contact point would be here. You'd have part of the separator would be up here, and you've got a double piece of the separator coming around like that, and you tie the dental floss over the top of it this way, and so you got a kind of a double separator, and you don't necessarily have to come up between the gap. You may want to separate something. Sometimes it's got a rough spot in there that cuts the floss or cuts the separator itself, but you can pull it up in there and tie it, and it really separates, and it pushes these teeth apart to where you can get bands or whatever you need to get in there to separate it. So that's another trick you learn with this. Now let's see. This is just another view of that. Now here I pulled on that, and one strand of it came through and the other one is underneath. So your contact point is here and your separator is around like that on the contact points here, and this will push that apart and separate it. Rarely do you ever lose the separator out of the space. It'll open it up, but it'll still not be wide enough for the separator to slip out and come out. Now if you do, they're opaque and they don't get around the root of the tooth and go all the way to the bottom like a rubber band. Now you can put a tight rubber band around a tooth and it'll just work its way all the way down. You can extract the tooth putting a tight rubber band around the tooth. Now if you took the separator and was big enough to separate and put over the tooth like this, it would be very dangerous. You would not want to use something like that. So anyway, we pull it through like that. Now here is a separator that's put in right between those two. Looks like between a couple of molars right here. And you may have a wisdom tooth that's trying to get in back here that you want to put a separator in that area to push the wisdom tooth back so it could come up. Now a lot of people don't realize you can use a separator like that. Now, this is just another view of the separator there. Let's see if we've got, okay, here there's tissue over this second molar. So you don't see the second molar down here, but you x-rayed it and you know it's there and everything. You've got tissue here, and you've got a wisdom tooth coming in back here, something like this, you see. And you want to get this second molar up into the area, and you've got pressure on it from both ends. You can put a separator in this tooth right in with this space, even though you do not even see this second molar right here. Now, what you do, you take you've got your separator on your floss out here, and you got floss coming out this way and over here, and you've got another strand of floss, and you can slip the double strand of the floss down between here and get it down this area, and you pull on it going this way and kind of go back and forth like you were shining a shoe or something, and you can work this floss down along the neck of this tooth. I'll clean that up. You can work it down into this area. Now you keep tension on it from that side, tension from this side, and you pull on one side of the double floss and let the other one slide under, and you can slip the separator in between this tooth and this tooth, even though you don't even see this tooth in there, but you x-rayed, you know it's there. Now sometimes this is pretty touchy there, so you have to do a little topical, or else you have to give a slight injection there just to deaden the tissue in that area. Now you get your separator in the middle of this. You see, you can pull on the separator and pull it out, and you can see separator on both ends. Now of course you slide it up in there. Now you may not be able to pop that separator so that it fits in there like that, and you may have to tie the knot up here. So let's say you couldn't get it to come in this gap right here, so you pull one side of your floss over here and the other over here, and you very carefully tie, and I tie 3 knots that'll be right up in this area. Let me clean that up again now. So we'll have a kind of a double part of the separator over here, and it goes under it, come up on the other side, and we'll have a double portion of the separator. And now we tie across here, and that puts quite a pressure on this tooth, and it'll move this tooth back, it'll move this tooth forward some way or another, and it'll shove the wisdom tooth out of the way. Now if you push on the bottom part of this wisdom tooth, it tends to kick the roots up. If you pressures on the top part, it'll tend to push the root down over here. Now before we do that, a lot of times, rather than go through this, we will remove a band we've got on this, take it off temporarily, and get this tooth up in here, and then we'll have, in other words, this tooth will be sitting in here kind of like that. Then we can just separate it normally, put this band back, and you may need to band this over here, or you may need to get this tooth out or do something with it to make some space. And it looks like here you got a tight situation where you're not going to be able to get that wisdom tooth in, so you send it to an oral surgeon, get the tooth taken out in here, and then you go ahead and finish your orthodontics out, separating it that way. But I've brought in many, even wisdom teeth. I've had them clear them out where they could erupt on in as long as I had space for that wisdom tooth to come up in the mouth, I could push it back and get it in. Then the jaw would be going up back here, and you had room for the wisdom tooth. If you got room, keep the wisdom teeth. They're one of the best chewing positions in the mouth. You see, the muscles are right in this area right here. So it's really good to use them. And of course, if you have a tooth that's bad here, you can slide these teeth forward, or this tooth out, you can slide all of them up into this area. So you can always close this up. And you can do this when somebody's 50 years old. They don't have to be, or they can be 60 or 70. You can slide the teeth forward as long as they got good bone structure in here, and they want to take a little while to do it. And we've shown that on many videos here. So this is placing a separator in an unerupted tooth to help get the tooth to erupt. Let's see what else we got here on the pictures. All right, there's the double. There's two pieces of floss, two over here, and we come in and tie a knot in this area right in there to get that separator where it's working in that area. Now, I don't, well, this picture, I think we were showing, see, the separator is down in there, and I guess we're going to tie a knot in there to get that separator in to push that tooth back like that. But you can do some marvelous things with separators. Now I got a separator back in here, and there's a tooth underneath here. Of course, we got a cavity in that one there. Somebody I'll have to send that one in and get it filled. Look like there's another cavity back in this area. That's a pretty amalgam that's pretty deteriorated there also. So anyway, this was just showing these separators. See the floss coming out here, and there's floss over on this side, and we've just popped this up on one side. So the separator's here, and it goes down underneath there, you see, and the contact point is right in between here, and this will push that out in that direction. So we've brought in a lot of slightly impacted wisdom teeth and second molars and various teeth with separators. So if you learn how to use them, they're quite good. And so now I'm going to show you some other things that we used to not have these elastics, so we had to use brass wire. This is a 24 gauge 16-ounce brass wire, and we used to have a spool of that, and you'd take this brass wire and just wrap it around a metal, something about the size of a broomstick, and you wrap it on there real good and just slide it off of that. And now you take that, and you've got a spring out of brass wire. You take a pair of shears and just reach in here and cut this, and now you'll end up with a whole stack of little rings that have been cut. With a cutter, it usually leaves a kind of a sharp edge on it. So now we've got these little rings like this. Now I have done this where you in years past, and you could do it today if you really need to. You take a piece of this brass wire like that, and you have a flat edge wire, and just mash the heck out of this, and where the wire comes out kind of round like this, you will flatten it out, and you'll have just a flat piece of this wire. It'll come out be kind of like that. Now you can take a pair of shears and cut this like such, and it'll leave a sharp point over here. You sterilize it, and you can make a needle out of this brass wire. Now, you think this is pretty crude. You got to take it and sterilize it and all that good stuff, but you can go through some tissue and go under the tooth, bring it back over and twist this down, and they'll separate your teeth. And that's the way we separated for years, you know. We had to use this brass wire type separators, and you put it on your Matthew needle holder, and you've made this into kind of a point over here, and you just, it'll go right through the tissue and go right between the tooth and come out on the other side. Bring it over the top, hook it with that and twist it down. I'll show you that here in just a second. Wait just a minute. I've got to go back and erase that. Alright, now this is that way, and you can slip that through. If you had to, you could go through tissue with it. I don't laugh about that. I have a little ranch out here in Glen Rose, and I've had cows that tried to have a calf, and sometimes the whole placenta would come out, and we'd have to wash it off, stuff it back in, and we had to sew them back up. And I was out there on a cold night, and the vet didn't want to come, and he said, well, just sew it up. And I said, well, I don't have anything to sew it with. He said, well, you got a pair of pliers, and you got some hay wire there. And I sewed that poor cow up with the short pieces of hay wire and twisted it down, and she lived, and the placenta stayed in, and the calf lived. And I never saw her. She never came back to get the sutures out. But anyway, you can do some things you don't think about, and people used to have to do a lot. But anyway, we twisted the separator down like that, and they made pretty good separators. And you had to come back and clip this thing, pull it out, and you'd have space in there to put the bands. And we used to band every blooming tooth in the mouth, and that was really tough on you. Sometimes I think it'd be good if every young orthodontist, anybody trying to do orthodontics, ought to have to do one or two band cases just to, so they'd appreciate your brackets. It is so much nicer with brackets. All right, lastly, and I don't sell anything for anybody, but TP came out with these little spring separators like this right here. And those things, everybody ought to keep a few of them around. They really come in handy. And to use them, you have to grab them different from what everybody thinks. You just hand one to somebody and they'll stick a pair of pliers in here and try to get it on. That's not the way to use it. Your plier has to come right in here. It has to be real small nose jerry-back pliers or something real tiny points on them. You grab that thing right there, you catch it right here with the plier, and you put this part on the tooth up here and press on it and bend this spring out like this, and this wire sticking here, and then you feed that wire underneath your contact point and come over here, see, with it. In other words, you press down and open this up, and you run this underneath here, and then the spring on it will pull it back up in that direction. And I've never lost one of them, and they'll stay in there and gently separate the tooth, and you can take them out. And just when you go to remove them, you can take this, catch it up here, and raise this up and slide it backwards, you see, and take it out of the mouth. It doesn't hurt them at all, and I people would turn their nose up at sterilizing these things and really clean them up. You could use them again, but some people don't. They think of that as terrible. Well, years ago we had to use everything, even needles, so we don't do that anymore, but you could use these. But anyway, you ought to have some of these. You can come in little packages of 10 or 100, and they don't give them to you either, so you need to use that. So this pretty covers the things that we can do with separators. And if you haven't tried some of these tricks with them, well, it's good to try them. So anyway, you may never use any of them, but it's good to know, because every once in a while something pops up that you have to do something, and if you know how to do it, it makes it a lot simpler. So good luck. So I'm going to sign off here, and maybe you'll get a little bit out of that little video here on how to use these separators. I have enjoyed some of these tricks over the years, and they help you get a lot of things done that you couldn't do otherwise. So good luck, and we'll holler at you later. Bye-bye.